We will see both a trigger finger, trigger thumb, and Dupuytren's contractures, especially with the Sun Lakes population of the Northern European descent, which case many patients will start with just that clicking or popping. With a Dupuytren's or trigger finger, we should be able to hopefully catch it early. Severe cases are probably going to need surgical intervention. Many times you can talk to them about trying to help the system before going into surgery. So if a patient presents fairly early, we're going to not just look at the zones affected, but also the muscles and tendons that go with it. If we can relax the forearm flexors, that'll further help how the tendons sliding through the wrist and hand and into the fingers. So working both flexors with massage, grasp, and stretching using the vibration stretch tends to work pretty well. They can take their hands, place on it, or just use fingers, showing them how to stretch their fingers on their own. Cold laser to decrease the fibrosis. Graston, we can slide all along the tendons. You're going to feel it get pretty gritty. The larger knots that are starting to form are going to feel harder until they can get softened up a little bit. What we don't want is that click and clunk that they start to get. Once a finger kind of really gets locked down, it gets pretty difficult to get it open back up. Graston tends to do better in the earlier stages. Later stages, you're trying to help and clean up for surgery, but a severe curl with limited extension is almost always going to require the surgical intervention. Other treatments they're going to ask is about when they inject it with a needle into the area to eat up the scar tissue. It does provide some relief, especially in conjunction with physical medicine treatments. Really, a significant amount of treatment is trying to get the area stretched out and opened up, teaching them to change their hand habits, getting them to keep their fingers extended, working with Graston, the ice and heat variant, along with the forearm flexors. With Graston, even if they only have fifth and fourth finger involvement, assume second and third is involved also. Work the whole zone. Work everywhere from the carpals towards the fingers and then to the fingertip. We can keep it neutral as they improve. You can open the hand up more and stretch, or just stretch the fingers you want. Once again, popping up the affected areas. We can stretch and scrape. That'll provide more tension. Be careful, it will increase their pain as we can break up more scar tissue than we're originally planning for. It can be pretty sensitive for the patient. Once again, whenever you scrape, make sure to have them stretch and ice afterwards to help reduce the sore side effects.